I was a nurse for 5 years, and then I still am an RN, and I don't practice as an RN in the hospital or medical field right now, but I actually was very sick for a long time, and when I was 21, I started getting sick and couldn't find out what was wrong. I did lots of blood tests. And just got worse and worse. I started having 15 food allergies. I couldn't eat anything. I lost 40 pounds. I was walking, like I couldn't really do any exercise anymore because I couldn't have the energy. I actually quit my nursing job because I couldn't even work in the medical field. Like I just didn't have the energy to pour out anymore. Lost all my energy. But it wasn't until about like 6 or 7 years later I found I had Lyme disease. And so it was a process of healing. And the way that I did it was naturally. Because there was other routes. I thought, well, I could go on antibiotics. But what I researched was that you can go on antibiotics even up to 2 years and people weren't getting healed from it. So I decided to go the natural route. And I just prayed. I researched and I studied myself and then became a natural health practitioner, and that's how I really got into this whole thing and turned my health around within 6 months. Praise the Lord. And so anyways, I'm not a doctor. I don't diagnose, treat, or prescribe for disease or anything like that, but I just help balance body with nutrition, with superfoods and all that, and I see good results that way. And next slide. I'm first off going to talk actually about the medical side, and we'll go through that as much as we need to, and then I'm really going to focus on the holistic end of how to prepare. And so I'm really excited about preparation. Actually, like 4 years ago, I had an experience, a couple of them within a year, probably about 10 of them, where I would just walk into people randomly that would fall out on the floor, had like a seizure, one place where a whole family had an accident, and I was the first on the scene. So I had to like practice what I learned in my schooling. And so this really like actually woke me up. And if any of you know, like for me, I heard when I was going through that and it kept happening. I'm like, what in the world is going on? And from a perspective of like, this is not by coincidence. It's not by coincidence that in a year I'm happening to run across like 10 freak accidents. Car accidents, then this, and someone pulls out and someone cuts their leg, and I'm just there all the time. And so I was like, I asked the question, God, what are you doing? And he said, get ready for disaster. And at that time I was like, what are you talking about? Like, what do you mean? He goes, read Jeremiah. I read Jeremiah, and it was at that time that really I started getting stirred. That probably was 4 years ago. And so really, this is really, I'm passionate about all kinds of getting ready and getting ready healthy. Getting ready for more than just the medical of the urgent health, but really the long-term health. So this is the first aid kit. I would really highly recommend everyone having a first aid kit in their home. This is kind of like a toolbox, but just putting together a first aid kit is just really important to get that together. And here's some of the first things. First aid guidebook. Aloe vera gel is actually a cooling agent for burns. Iodine, alcohol, latex gloves, sterile gauze, eyedroppers, 2-inch roll gauze bandage, thermometers, ammonia inhalants, sterile saline. And actually, I learned that you can make sterile saline if you don't have it. Bandages. And then, next slide, scissors, burn cream, alcohol swabs, triangular bandage, an ice bag, a trauma bag, pad, antibiotic ointment, tweezers, flashlight, matches, instant cold pack, cotton tip applicators, and Tylenol and aspirin. Now that would be the basics. You could also get like a mask, different masks, or air compressor, or oxygen. So there's different additives that you can add to your first aid kit, and you can buy those. There's different first aid. I'll show you at the end different websites that you can look at to actually just buy the whole kit already pre-made for you. So a trauma pad is like a really thick pad. Like if there was a lot of bleeding, you would stick that on there to prevent the bleeding. Yeah. Okay. Any other questions? All right, next slide. Roll of wide adhesive tape,
oval iPads, tongue depressor, cotton balls, peanut butter, and I'll tell you why later, blanket, goggles, mask, tourniquet, possible syringe, large garbage bags, and then I said oxygen supply. I already told you that. Okay, next slide. Okay, so what do you do in an emergency? So in the cases where, like I said, 4 years ago when I came across these emergencies, I actually didn't really expect that that would ever happen to me, none of them. But they did happen, and they don't always happen to just a nurse, or they could just happen to you. And especially in time of disaster, when someone's, fallen out or they lost their blood sugar goes low. But you want to make sure that you evaluate the scene always. No matter what happens, evaluate what's around them and evaluate if there's any damage that could possibly come if you enter the scene. And always, number 2, remain calm, because as soon as you get really hyper or you start screaming really loud or you don't know what you're doing, your mind just goes off if you see something that you've never seen before. Just remember, remain calm, and don't, number 3, don't move the person unless an immediate danger like a fire or flooding, of course, unless they're going to die, unless you have to move them if they're going to die either, But don't move them if they, passed out and they're just laying there. And if they got hit, you don't know if they broke their neck or whatnot. So, number 4, call for help. So you get there and you're calling for help, whether it's loud or you have your cell phone with you and you can do something at the same time. Number 5, ask, is the person choking? I mean, honestly, and 6, they kind of go together, but when you look at the person, are they breathing, airway, breathing, and circulation? You have to make sure you're looking at all those 3 things, because those are going to be crucial, whether they'll live or die. And number 7, if they're not breathing, of course, and you realize that you perform CPR if their heart is stopped. Number 8 is person bleeding. I mean, you want to look at that. Make sure you look underneath their back or what they're laying on. If they're bleeding and you can't see it at that point, but make sure you kind of look. Just kind of look to see if there's blood or anything anywhere, any liquids. Number 9, shock. Ask the question, if they're going through shock, and I'll tell you what shock is in the next slide. Number 10, do they need I guess the slide after that. The recovery position. So if they are choking on something, or you notice there's fluid, and you want to roll them into the recovery position because you don't want them choking on the fluid. And the recovery position is actually to their side with their knee over the other leg and their arm over like that. Does that make sense? Okay. And get CPR certified. So I'm not actually going to teach you CPR tonight. That would take another whole class. And I just recommend everyone here get CPR certified. And you can get that through any American Red Cross or through hospitals. You can also go further and get an EMT course at hospitals, universities, or colleges. They're all great ways, and they're all very important. It's really important to have CPR. Okay, so what is shock? Next slide after that one. The signs and symptoms of shock are pale, no color, profuse sweating, and delay in the skin beds of the nails. So when you look at the nails, there's no blood flow in the nails. That's capillary refill, how fast the blood is flowing through the nails. So 1, check airway, breathing, and circulation, same thing again. Stop the bleeding. And number 3, keep the feet elevated so that the blood stays with the major organs. Does that make sense? Okay. And don't raise legs if you suspect a broken back or a head injury. That won't be good. Okay. Another possible problem that could occur is carbon monoxide poisoning with any fires. It's crazy. I actually had a dream a couple weeks ago that I flew into Thailand and there was all these fires. So I don't know what that means, but it just makes me remind me of people burning. And the carbon monoxide poisoning is basically because carbon doesn't, it gets into the blood system and it binds to hemoglobin, which is in the red blood cells, instead of oxygen binding. So that doesn't allow the oxygen to move through the red blood cells, and the person loses consciousness over time. So you have to remove the person to fresh air right away. And then you need to have compressed oxygen delivered. and they need to be taking in pure oxygen to replace the carbon monoxide. So some of those symptoms are fatigue, extreme headaches, or delirium. And then over time, if they really get carbon monoxide poisoning, they'll pass right out and they could lose. Okay. Next slide, insulin shock. Another possible, does anybody have diabetes? You don't have to say, but okay, so what you think, okay, if there's disaster and you don't have insulin on hand and all this, guarantee there's going to be some of this going on. If the person's lost insulin, if say all the hospitals are crashed, I'm just giving the worst examples, and you don't have anything to go to. But anyways, if you notice some of this and this person has diabetes and they experience some of these symptoms, shaky, extremely hungry, altered level of consciousness, basically just not thinking clearly, alleviate those signs by getting sugar and food into their body right away. That's why I put protein, which is a good source, peanut butter. That's why I put peanut butter on there. It's a good source to help get some of that, but even more immediately is orange juice or some sort of sugar. It's more quick. Another way is you can rub some orange juice or sugar on their gums so it gets in quicker if they're semi-conscious. Now, if they're unconscious, just remember this, don't force any food down their throat or anything like that. It could cause total death or, if they choke on it. So, okay, next slide. Okay, stop bleeding. Now, I don't know who's scared of blood here, but I know a lot of people are. They see a lot of blood but it's important that you just kind of block that out. I know that the first time I think I saw blood, I almost passed out. I'm pretty sure. But it's important that you just kind of put that to the side and just think of it as fluid. That's how I think of it. But sometimes people see large amounts of blood, like red. It's red blood, and they're like, Just the thought that large amounts of bleeding could cause death actually makes people nauseous, But I think of it as, okay, we all have blood. We all have a circulatory system. We're all full of blood. And when we see someone bleeding, just make sure you put gloves on and make sure you have gloves in your kit. And apply gauze to the site and with firm pressure for 3 to 5 minutes. This is more mild bleeding. And then if it bleeds through, put another piece of gauze over that and hold that. And don't remove the old dressing. So just keep pressure on it. Now, if it's not controlled in 3 to 5 minutes, then you actually want to raise the arm, if it's in the arm or the legs, above the heart and apply pressure on the artery. So if it's a brachial artery, it's actually right here. And if it's a femoral artery, it's here, if it's in the leg. So it's kind of right here. Okay? And now, if it's really bad and the bleeding doesn't stop for 10 to 15 minutes and they're losing lots of blood, then you apply a tourniquet. Now, next slide. How to apply a tourniquet. Basically, you want to place the tourniquet above the injured site at least 2 inches away from the wound. Wrap one time with a single knot. That's kind of hard to explain. Has anybody ever applied a tourniquet before? Okay, and then you put a piece of wood or screwdriver or pencil or pen, if anything else, and you twist it as tight as possible so it's really tight. And then you wrap over the object and twist again and tie it tight until it's knotted. I was going to demonstrate that. Well, let me just demonstrate it quickly.
This is my husband. Wonderful Paul. Okay. So basically, if the wound is here, you want to make sure you put it 2 inches above. And then tie it tight. I'm using a pen. You want to put another knot around that pen, or if you're in the woods, you take a piece of wood and tie it again really tight. Now you want to twist this really tight. See how it's getting? And then you tie again. Trying to strip around. I don't want to hurt him. And then you tie it again into a knot until it's tight. Okay? All right. Just that little demonstration. Okay.
All right, first degree burn. Now, next slide. First degree burn. This is what I got this past weekend. I wasn't good because I sat out in the sun for 3 hours and I didn't expect to get burnt, but it was my first time in the sun. But basically, it's reddened with no skin coming off. And you run cool water over the burn for several minutes if you get a burn. And actually, if I've noticed this with first degree burns, if you just take a cold shower for 15 minutes, you'll lessen the deepness of that burn. So after you wash it, dry Elstero gauze and put burn cream on it and take a pain reliever. That's pretty simple. And I'm sure everyone here has gotten first degree burn. I'm pretty sure, unless you're really safe. Second and third degree burn. A second degree burn, it's more blistering. And a third degree burn, it looks charred or blackened. And there's more numbness or loss of function in that limb. Number 1, put cool water on burn for at least 15 minutes with synthetic material or cotton. You want to just pour cold water, but you'd actually like damp some sort of synthetic material or cotton and actually place it on there. And then dry and apply sterile dressing. You don't have to put any like lotions, definitely no lotions or anything, but before they get to any hospital or medical personnel, this is more for lay people, is just put some dry gauze, wrap it with gauze material and tape it, and then take them to a medical personnel. Especially when they get to third degree burns, there's other things that need to take place, and you don't want to deal with the depth of that. So, guidelines for burns: don't pop the blisters. It's natural healing. Do not apply ice. Some people think, oh, I'll just apply ice, it'll get better, but you could actually numb it out more and create frostbite. Do not put oils or butters on burns, and wear loose clothing. That will help. And just remember that electrical burns can cause irregular heartbeat, so watch for this. Oh, next slide. How would you cleanse a wound? Well, definitely make sure your hands are clean and scrubbed with antiseptic and disinfectant water. Prepare your disinfectant solution. Wear gloves. Make sure you scrub the area around the wound so that the debris or anything bad doesn't get into the wound. Remove objects from the wound with a tweezer, and then irrigate the wound and rinse with a disinfectant solution. And after cleansing the wound, pat it dry. Apply antibiotic ointment or an ointment. Maybe at that time you have something that, like a silver. This is actually a really good. They actually are starting to use this in the hospitals now, like a silver. But it helps with wounds. Helps with burns too. But antibiotic ointment is the first choice for lay people. And then cover the wound with gauze. Wrap with a 2-inch roll of gauze and tape. And then make sure it covers like all the way around. Don't leave any of the wound on the exterior uncovered, because then dirt or anything can get in there again. It really can open up the door for infection. Next slide. Well, infection, what does it look like? Basically, look on the bottom there, signs and symptoms: redness, tenderness, swelling, pain, and a person who has a temperature over 100 degrees. Okay, next slide. Hypothermia, which could happen if there was a disaster and there's no shelter and it's winter. This could happen pretty quickly. Comes on suddenly. Put many layers on the person. Hats, gloves, blankets. You could actually get blankets that are like hypothermic. They have survival blankets just to keep warmth in. Now you can pass this around for a second. And then stay out of the nasty weather. Drink lots of water and eat lots of carbohydrates. Okay, seizure. I've actually seen a few of these before, and I don't know if you've seen them, but it's really interesting because you want to help the person so badly, but they're flailing all over the place a lot of the times. I mean, there's different kinds of seizures and there's different levels. But make sure you just keep them in a safe place. Really just think safety first. Put something soft under their head, like a pillow. Remove anything away that the client can injure themselves with. So if like they're near a post or something, just remove it away from them. And they could bite their tongue and they could wet themselves. That's actually normal with a seizure. If they start to vomit, make sure you roll them to their side, that they don't choke on their vomit. Make sure you follow up with them after the seizure's over, and never place anything in their mouth. Actually, some people think that you can put something in their mouth, but it's actually very dangerous. So, And then broken bones, I just wanted you to think of 4 things. And I'm sure, again, many of us had broken bones in our life. Rest, elevate the site, ice it, and stabilize it. That's the basics for us lay people. Next slide, heat exhaustion, which is kind of, it's pretty self-explanatory. The symptoms are fatigue, nausea, vomiting, headaches, and high temperature. And it can go into a stroke, which is more difficulty breathing, strange behaviors, even hallucinating, saying weird things. The pulse is really fast, agitation, the person gets angry. So we look at, okay, if there's heat exhaustion and a stroke, drink lots of water. That's self-explanatory. Cool the body under a shade, fan the body, and continue to get much fluid replacement. That's the biggest thing, is lots of water, lots of fluid. Okay, next slide. Okay, this is the simple triage and rapid treatment method, and it was developed in 1983 in California at the Hoag Hospital just for lay people. Lightly trained and emergency personnel use this model. It doesn't supersede the medical personnel or techniques. In the next slide, basically there's 4 categories to the start, and you tag people based on if there is a disaster. You tag them with codes and a color code. And this is their model. And so I thought this is the basic with colors. The deceased who are beyond help, you put a black tag on them. So if you see black tags, those people basically deceased. They're dead. And 2, the injured who need immediate help and transportation to the hospital, or they're red tags. Pretty self-explanatory, red is more bright and urgent, I guess. Number 3, the injured whose transport can be delayed. They're tagged with yellow. And then number 4, those with minor help who need less help at the present are green tags. And then they also have white tags, which are just those that don't need doctor care at all. Does that make sense? So it just kind of gives you a brief. If you ever encounter a major disaster and there's a lot of people with medical need, there's that basis. Okay? Now, if you are in a city or a town and there are people coming from the outside with unsuspected illness that could be passed on really quickly, here's some just basic understanding of what could happen. And let's say it passes really quick and you die within the first week, like a virus hits you and the people are dying off. And you know that if these people get into your city, your chances of living are less and less. But this is the basic, and again, this would be when there's nobody to help and no medical personnel, nothing. It's just you and a few people. You could quarantine them for at least 2 weeks. So find one place, they have to stay in it, they can't leave, and then see how that works. Feed them off paper plates, so nothing like hard that could pass any sort of infection. All items being reused should be boiled or steamed. All linen should be cleaned at high temperatures and bleached. And used dressings needed to be burned or buried deep away from other people. So if you're using dressings, definitely don't just throw it in the garbage can and hope it doesn't pass anywhere through water or whatnot. This is the worst case scenario, of course, and it's definitely not the one that we'd ever want to face. But the possibilities are endless with the medical and like what could happen to a person, and we never know, right? So, but when somebody dies and there's nobody there and no family members, and we think about that, and it's important that if the person died from a major disease or infection that is spreadable, to bury them right away. And to tell the loved ones and to write things down on paper and write the day of death and write all these things that are important possibly to the future family member you might meet. And be there for each other, of course, and love each other in the midst of it all. So, all right, I'm really passionate about this, and I don't know how to like speak how passionately I am about holistic type of healthcare, and just it's a different way of looking at life. And I'm passionate about preparing holistically for any sort of disasters in the future for a number of reasons, because you need to be healthy to encounter disaster. And you need to be healthy to help other people encounter disaster. there's many people who are experiencing things that if there was a disaster, they'd be like, I don't know what I would do because wouldn't have this, or I wouldn't have this. And you guys can put the name in there or whatever. But if you didn't have whatever when you encountered that disaster, and let's say you have pain in your body every day right now, which a lot of people do, people say it's silently, or maybe they have pain and it's normal to them. Personally, I don't think it's normal, but it never was normal in the 1900s to have regular pain or be chronically sick. So I really believe that healing can come on all levels, both mind, body, and spirit. And that's why I do focus mostly on the body. That's my focus. But I believe it's all interconnected. And so if you look at all that. So you have to have energy on the next slide to prepare for the unexpected. When you're under stress, you even have to be more prepared. And if you can imagine, if there was any disaster, even small to big, like the one that happened in Joplin, we don't know. I haven't heard any stories. I wish I did. But if you weren't prepared for it and your body was already stressed out with this or that, maybe headaches every day, maybe you don't digest things very well, maybe you have pain in your hips every day. I'm just saying you can't walk very well, but the disaster comes and you're not ready. Your body's not ready. You're not ready to handle that stress because your home just got taken or whatever. Like, that's stressful. And the more stress that you have in your body, the more actually your body starts to manifest that stress with different things. So that's what I love to look at. Okay, what is it that the body can handle? And the body can only handle a certain amount, and we can push ourselves as much as possible, but then it crashes. And I believe that when the unexpected event will come, many people's bodies will crash even more than where we are right now. I really do believe that. And I think that it's because of the toxic load in our body today and what we eat. And I'll go into detail with that. But toxins stored in the fat, they can be released when we go into fasting mode. That's why people get a little grumpy or whatever. You know, it's like, I didn't eat today, but I'm really grumpy. But you're actually releasing toxins into your brain. And if you go further than that, it's just, if you weren't eating for like 20 days, because there was just no food, it would be better if previously you always ate healthy than if you ate a burger every day or you ate sugar and had sugar in your diet every day. It would have been better if you just ate healthy this whole time. And if you had to hit something like that, it wouldn't have affected your body as much. I'm being real. It won't affect your body as much if you stay healthy previous to a disaster. You'll be able to handle it better in every way, mind, body, and spirit. All right, next slide. I'm just going to talk about a few things. 7 steps to healthier lifestyle. 1, eat healthy. I would say that's the number one thing. It's about your diet. It's about what you put in your body that shows the effect on your skin, on every area of your life. And for me, when I couldn't eat 15 different kinds of foods, wheat, dairy, sugar, I mean, that was stressful. And I don't expect, it really just has to be a healthy diet. And I'll go into detail. Supplementation is another way to help the body get back to where it needs to be, because a lot of us are deficient. Detoxification, we look at our emotions, our thoughts, exercise, and gardening. Okay, so I'm going to talk about eating healthy, which, I mean, every magazine you'll see something about what you need to eat and what's better for you if you're this or this age, or if you're in your 50s, you should be eating this. But I really believe that everybody needs to stay on the same basic. You need to always have protein, carbohydrates. You need to have your vegetables. You need to have your fruits, because if you just go on a carbohydrate diet or whatever the diet is out there, it will come back, Your body was created to actually receive certain kinds of nutrients. And most of us are not receiving it in our food fully. And that's the honest truth, which is actually why a lot of us go downhill in our health. And this is my basic rules. Lots of fruits and vegetables, but make sure you're getting your protein and carbs. As much organic as possible is actually helpful for your body, just to stay away from the pesticides that are sprayed on the foods today. And even in dairy, there's a lot of extra hormones that are put in dairy products. I won't go into too much detail because I could get on a thing with this, but so it's just as much organic as possible. Very little to no refined sugar. Did you know there's a study that if you eat sugar, it actually changes the brain chemistry in your brain? It actually kills off neurons in the brain. And definitely we eat way more sugar than we did 50 years ago. And it has affected us. It has affected our cells. It has affected the way that we process food. It has affected our livers, our kidneys, our skin. Sugar really is actually a toxin. And so maybe that's hard for you to hear. To be honest, I still have sugar once in a while. And I know sometimes I'm like, I shouldn't be eating this. I tell my husband. But I really advocate no sugar as much as possible, honestly. And I go ahead. Yeah, stevia is an alternative. Agave is good for, I think it's a good, but it also can also affect the liver if you take it too much. Another honey's great. I would say honey's a great alternative. Xylitol is great, and stevia. Those are basically the four that I recommend. Yep. Definitely not Splenda. I'm serious. That stuff's like havoc to your body, your brain, your nervous system. And I could muscle test on every one of you. I could hold Splenda in your hand, and you will test weak on it. Guaranteed 100%. It really creates autoimmune. It's really not good for your body. So I'm just being honest there. Little whites, so like I said, little sugar, no white flour would be good. Again, the processed stuff. No supplements can overcome a terrible diet. So you could take all the vitamins you want every day, and if you eat bad, it's not going to do you any good, to be honest. And that's why it's very important that what you put in your mouth every day for breakfast, lunch, and dinner and your snacks will affect you over time. If there have been studies that, now this is not me, that the body heals itself. We don't heal. The body actually reverses the process with diabetes if you eat a raw diet for 1 month. 1 month of a raw food diet. And that means diet means just raw food, like not cooked, because it's not processed. It has all of its enzymes, and it reverses diabetes. And so there's been studies done on that. You guys can research on the internet. Next slide. So now I talk about natural supplementation. So sometimes we get to a point where your body has it's just overdone. And you've been through 15 years of stress, and you had like someone pass away in your life, really stressful situation. You had someone betray you. It hurt your heart. You had like lack of, when you were growing up, all you really did eat was whites and sugars, and it adds up over the years. You had an injury. You had a back injury when you were 15, and then you went and had a car accident when you were 50. And over time, you're like, wow, I don't feel very good. Something's going on here. Then I recommend natural supplementation. At that point, we test and we see what are you deficient in. Many of us are deficient in vitamin D today. But what are you deficient in? Is it minerals, which most of us are deficient in minerals today. With what I test and my business and everyone I see, a lot of us are deficient in calcium and magnesium and aren't absorbing it. Greens are very important. Like I said, eat lots of vegetables. We're deficient in oils. Many of us are deficient in oils. That's why we're having the memory issues. We're not getting the good oils. We're getting the bad oils. We're eating the vegetable oils, the canola oil. It's not good for you. Olive oil is really good for you. Canola oil is not even as good. It actually is really bad for the brain. And lots of corn. I mean, corn is a derivative. Sometimes it's actually processed. And so, again, that processed food doesn't help. We can be deficient in vitamin B, a lot of us. And then enzymes and hydrochloric acid. And this is what I learned, and I'm going to share it with you because I believe it's good to know. Enzymes help break down your food. And it starts in the mouth. And when you eat food, it starts and you break it down. And a lot of us are missing enzymes because we cooked it out. When we cook the food, there's no more enzymes left to actually help break down the food. And then our pancreas actually, there's a learning that the pancreas helps release enzymes as well as insulin. And a lot of times, over time, the more food that we eat, the less, more cooked food, the less enzymes we have in our body to digest any food. That's why it's really important to include your vegetables and fruit is so that you have enzymes to help digest your other food that's processed and cooked and all that. And then digestive issues start coming. Why are people getting so many food allergies? I mean, maybe one of you know, but 4 years ago, nobody I knew had food allergies. Nobody I knew personally. Now, every other person has a food allergy. I'm serious. Within the last 4 to 5 years, probably 50 to 60% more people got food allergies of some sort. Like, not just peanut. Peanut used to be just with kids, but now it's like dairy and wheat and sugar and this. I mean, it's getting really bad, but it has to do with that. Enzymes and hydrochloric acid, because once you get over the age of 30, you start losing your hydrochloric acid in your stomach. Then people think that their heartburn is because they got too much when they got too little. Okay, so I could go on with this. It's a whole nother teaching seminar, to be honest with that part. Go ahead. Yes, yep. Right, exactly. The foods are more and more becoming genetically modified, like wheat. It's becoming genetically modified. My dad's a farmer, and he told me that that's what they are doing. And they do spray all their crops with chemicals. And then those foods go into cows, some of them. Some of them go to people. But they're all sprayed with chemicals, and they're all becoming genetically modified. You hardly can find, unless you buy organic, where it's not. And those genetically modified seeds are actually modified with viruses. This is really crazy. If you want to watch a really good movie, watch Food Matters, right? What's another one? Food Incorporated. Yeah, I can't. I mean, it's just crazy. Oh yeah, that's right. And the same thing is for women with hormone issues, which a lot of women are having hormone issues today. It's hormones that have been put into cattle and into the dairy that we're eating, and it's affecting our hormones big time. And then once a woman hits menopause, it goes like, it's just chaotic, because for the last 25 years they've eaten food that has been hormone induced, and they're full of toxins, to be honest. And so it's creating like this whole negative effect in their hormone. When their body's trying to balance out, they don't know how to balance. It's because of the toxicity in the body from injections that women ate with the food, the meats, the non-organic, which is like, when it says has not been injected with hormones, actually they say it on packages today. If it doesn't say that, more than likely the meat's been injected. Like somehow the cattle, they raise it on large crops now. So it's very different. And I really want to say this, in 1905, less than 5% of people in America were chronically ill. Guess how much it is today? It's more than 50%. It's a huge difference. And it has to do with this stuff. Well, we'll continue on the next slide about how to detoxify, which is a really crucial point in how to get better. I actually, I don't do the work. I just say, hey, why don't you detoxify? Your liver's toxic. Your kidney's toxic. You're not processing things. I can actually see, and I'll tell you how I do that at the end. But we start off toxic, actually. There's been a study that children are actually born with over 200 chemicals in their body today. There's been studies shown that in the placenta, it's passed from the mother to the baby already, and there's chemicals shown up in the baby. And I think like a little over 180 are cancer causing. And I actually just talked to a friend, and she just found out 2 of her friends' kids who are less than 5 years old have cancer. I'm not surprised, but I actually was, because I was like, I'm not hearing this, but now I'm starting to hear it. Younger kids having cancer, and but the exposure to over that many chemicals before birth, just that alone. And then dental fillings. We actually, most of you would never know this, but actually the amalgams, the silver fillings, 50% of them have toxins in the mercury, and mercury is very toxic to the body. I would say it's the number 1 toxin as far as heavy metals. That maybe what I see and what I've tested in people, I can see it on this slide thing that I'll show you at the end. But people are toxic with mercury, and it affects us in such great ways. It affects our digestion, it affects our memory, it affects our brain, it affects our joints. And when I detox people with this, like help them and say, hey, why don't you just take these herbs? It's all natural supplementation. It's all like, they actually get better. And there's processes of doing it, but people, their pain goes away, and it's awesome. And then the next point is the vaccinations actually have doubled since 1991. Now I'm not going to go into like what I fully believe, but I do believe they have methyl mercury in them, and you can actually see it on the vials. It says methyl mercury. I do think it affects people if they're given vaccinations. Someone from a medical field like me probably shouldn't agree, but I do, and I've studied it much, and so I do see vaccinations affecting people. And when I when I help people pull heavy metals again from their places where they've been vaccinated, I see amazing results. And autism, I mean, honestly, I don't know. It's not me. It's just the Lord, you know. So, and then food. The next slide there. It's chemicals. It's in our food, and we talked about that. So the next slide. That's good. Emotions play a huge role in how your body responds to detoxing, and everything, because we can have like an emotion of anger, and it actually can affect our liver. And we don't really, like, this isn't a study done through Chinese medicine. I like to think of it as just the body responds with emotion, and we're so interconnected that every part of us, that how we think and how we respond to situations and all that, it actually affects different organs in our body. So I just wanted to point that out, and I noticed that. And if I notice someone has a liver issue, I will actually sometimes have asked them, are you dealing with anger in your life? And again, guarantee 100% yes. It's interesting. And I even different other things like kidneys, if people have kidney issues or kidney failure, they've dealt with a lot of fear in their life. And that's very interesting to me. So it's very connected. And the next slide is positive thinking. And I think this is really critical to healing, because somebody who's dying and then they don't believe they're ever going to be healed again, and it's going to be very hard for the body to reverse. And the way that your body, do you think about your body and how you will process your healing, or if you're going to ever be healed again, it actually shifts the cells in your body. So if you actually know and can declare in your subconscious that you are going to be healed, it changes things in your body. And if you're declaring, I'm never going to be healed, do you know what that does from the brain to the cells in your body? It actually reverses them and think, I just can't. The body can't do what your mind, you can't polar them. And so even in Proverbs 23 verse 7, as a man thinks, so is he. And it's the same thing if you love yourself or hate yourself. And when I went through my healing, it was more than just the physical. I had to train my mind to think differently about my body and all these things that I didn't think I was going to be healed because I was so sick. And everything around me was saying, you're going to die. I got to that point where I thought I was going to die. But I had to really meditate on scripture and really think about what I was thinking and really take those thoughts captive. It's very important. So like I said, if you think you're never going to be healed, your body will have a hard time healing. That's really important. And so I talk to some of my clients about that sometimes and figure out, okay, are you willing to go? And people have cancer, if they've given up and they think they're going to die, it's going to be a lot harder for them to get past that. So exercise is very important. And I actually haven't been exercising as much the last 2 months because of my nausea with the pregnancy. So I'm kind of feeling like I'm hypocritical saying go exercise. But I'll be going to get a gym membership next month. But anyways, it's very important you exercise and get your blood moving, every one of you. It's all a part of your healing. It's all a part of moving the blood system, getting the heart going. It's so good for energy. It's really important. That's kind of my recommendation for myself, I guess. But weight training and cardiovascular work is very important. And then gardening. Has anybody talked about gardening so far in the last 2 days? I thought so. So we'll just kind of skip this, but it's important. Yeah. So, okay. So now this is my recommendation. You have to take care of yourself now. Don't wait 10 years. Don't wait till you have a heart attack or diagnosed with cancer, or your pain got so bad that you couldn't walk. it's so important to take care of yourself now, eat healthy now. You know, it's so important, and to take preventative measures. And even with, like, my parents came up this weekend, and like I said, you know, my dad was a smoker for 30 years, and I tested his heart, and it was weak. And I'm like, you know, I could help you with this. Get on some herbs, you know, cleanse your heart out a little bit, and it helps. And so, but take preventative measures. Be proactive. Make a decision for yourself. And those last two are the most important things you could do for yourself. Seriously. I mean, love God first off. Love yourself and others. And forgive yourself and others. It's the best remedy for anybody and everybody, and for your whole health. And there's been studies shown that if you don't forgive, you can't heal. And like where I've worked with doctors and naturopathic doctors, and they have stories where there's wounds, they don't heal, and they find out they can't forgive. Once they've forgiven, they've healed. I'm serious. So it's really important. So I actually want to talk just a little bit of natural remedies you can put in your first aid kit. And I did some studies on this. I passed out the peppermint oil and lavender oil. I have it right here, actually. They can smell that too. And I'll tell you guys what this stuff is. Cayenne pepper. In the old ancient way of, it wasn't medicine, but in the old ancient way of natural health, they would put cayenne pepper underneath someone's tongue, and it could stop a heart attack and a stroke. Why I'm telling you that is, don't go stop a heart attack and a stroke if there are medical personnel around you, but if you're the only one there and there's nobody around and somebody's having a heart attack, have some cayenne pepper, or like a made-up, it's called capsicum extract. Pass that around. And basically, if you put that on their tongue, it opens up the blood vessels, and their chance of not, like, stopping a heart attack or stroke is a lot less. I'm just saying. So maybe you guys can at least have some of that. Aloe vera, of course, helps burns and wounds. And then colloidal silver is a really good infective. It helps helps wounds. Charcoal, cemento. We'll go through them a little bit here. I like cemento, banderol, ticuna. They're actually natural herbs. I'm just going to pass a few of them around. And they're natural, but they kill. Yeah, so. Let's see, next slide. Well, there's tea tree oil. You go to the next slide? Let's just start here. Okay, I'm passing around the lavender oil. It's used for headaches. Nice. So maybe try lavender oil instead of Tylenol. Just saying. Sleeplessness, it helps relax you. So it's actually good to put on, like, if you can't sleep. And nervousness, it just helps to relax your body. And it's really natural. So, and then tea tree oil is a natural antibacterial, antifungal. It's a great non-chemical option. Sometimes they put it on canker sores or bruises, yeast infections even, or anything with the gums. You can put it on there. And then peppermint oil is really great for headaches. And actually, I used to use it when I was detoxing. I had a lot of headaches. I don't have headaches anymore, thank the Lord. But I had headaches, and I would put peppermint oil here and peppermint oil here. It would totally relieve my headaches and totally relieve my neck tension. It was really helpful. It's also good for hot flashes. I don't have them yet, but women out there who do. And go to the next slide, actually. I'm not going to talk about that one. Aloe vera gel, of course, relieves pain and inflammation, dilates the capillaries, and stimulates wound healing. And colloidal silver is actually a natural antibiotic. They use it, actually. I know they use it in some parts of different hospitals, but in different forms. Can be taken internally or applied externally with cream. And I have, here, take that. Pass that one around. Okay. I talked about cayenne pepper. But it's great for circulation, constipation, relieves GI inflammation. It's a potent disinfectant. And then I just put the next slide, the ones I passed around, cemento, banderol, ticuna, camanda. And actually with Lyme, I took cemento and banderol. And it actually helped kill off some of the bacteria. I did all this research and found that those two natural, they call them natural antibacterial and antibiotics, but I just call them herbs that kill. And they helped. Yeah, they helped. So you just can find these things. Dacuna is actually a natural antiviral. Now, sometimes, like with something like this, it won't kill off like a thing right away, but it's an overtime thing, and it will kill off gently. Okay, what do you do now and what do you buy? Buy your first aid kit. Get CPR certified and get healthy now. Learn emergency techniques. You can buy books on herbs and oils, and that would help just have an understanding of how to get prepared even more. And it's just there's so much knowledge out there that we just don't know today because it's just more medically based, and that's fine. But I'm just saying, in the 1900s, people were prepared. They really were. Herbally, they knew their herbs. They knew what to grow in their gardens. They knew that parsley helped with this and burdock helped with this. And we need to know this stuff. This is important. And so learn as much as possible. To be honest, you could be the next, like, if, everything was taken down, you're the one passing the parsley to cleanse the liver or, cleanse the kidneys. I'm serious. It's awesome. So that would be cool. And I just put some books down on the next slide. There's some books to read. And the websites to look at is a few there. Yeah. So Nature Sunshine is where I got the capsicum and the aloe and the silver shield. And NutriMedics.com, you can actually go to NutriMedics.cc, you can order some of that. And YoungLiving.com is actually great for essential oils. You can buy all kinds of essential oils. And those two are a few that I've let you try. There are like at least 25 of them that are amazing for different remedies, for different ways of healing. Really help the body.